Reuters.
That's it. You're hungry. Yes. Oh, that's what you need.
It's easy to think that having a baby is the same the world over. After all, it's something that we've been doing since we came into existence. But depending what country you're in, giving birth can either be a safe and for the most joyful experience, or a risky ordeal that could cost you your life or that of your babies. Here in Britain, we've come a long way since the late 19th century, when 1 in 200 women died in childbirth. That figure now stands at about 1 in 9,000. But new threats are affecting childbirth here. Budgetary cuts and unit closures in the National Health Service are putting women at risk, affecting their birth choices, and some say leading to more medical intervention. Compared to many places in the world, the Mayday Hospital just outside London represents a near ideal in terms of birthing choices for women. As well as offering a home birth service with community midwives, a labour ward which specialises in complicated pregnancies, it now has a new midwife-run birth centre. Head of midwifery, Debbie Gold, says the centre is aimed at women who want a natural birth, but also the security of knowing a labour ward is nearby if unlikely complications arise.
The other thing we're hoping, and I've known it happen in other birth centres, is that women come into a birth centre because they may be not so confident of a home birth. And when everything's really, really normal, when they have a second baby, they think, oh, I might just have mine at home this time. And so it's about creating an environment which is really comfortable, promotes normality, but actually sows seeds for the future as well.
But even in other parts of the UK, some hospitals aren't as fortunate in their facilities. Cuts and closures have reduced choice, and many women give birth in a more medicalised and in some cases understaffed unit. Dame Carlile Davis, General Secretary of the Royal College of Midwives, says this can lead to an increase in caesarean births, which are statistically more risky.
It is the view of this college and the government that every woman should have one-to-one care, particularly in labour. And if you haven't got the midwives to provide that care, then it means then one midwife is looking after several women in labour. And that leads to an increase in caesarean section births because women just haven't got the support which they should have. And what we're saying is that women should have the information to make those choices, and that where it is indicated obstetrically or medically for a woman to have a caesarean section birth, then quite right. But not because we simply haven't got the number of midwives and the mother is so frightened and hasn't had adequate support and pain relief as she goes through the labour process.
The outcomes of inadequate midwife and medical care are all too apparent in other parts of the world. The remote Afghan province of Badakhshan in the country's northeast has the highest maternal mortality rate in the world. Women are married off young here, 40% before they're 15. Often their bodies can't cope with the demands of sex and childbirth. Many, little more than children themselves, die in the process of giving life. 1 in every 15 women will die in birth. That's 600 times the British mortality rate. One maternity hospital in the provincial capital serves the whole region. For many, that can mean a 4 to 5 day journey by donkey over rough terrain and often in extreme weather conditions. It's not uncommon for women and their unborn child to die along the way. Sub-Sahara Africa is another trouble spot. For every maternal death in this region, it's been estimated over a dozen women become disabled due to pregnancy or birth-related complications. Regional conflict, a lack of infrastructure and cultural norms, as well as insufficient support at birth, all exacerbate maternal health problems here. The World Health Organization estimates that less than 2/3 of women in developing countries and 1/3 of women in the poorest countries have their babies delivered by skilled attendants. Much is being done to change this. The Royal College and International Confederation of Midwives, as well as international agencies such as the United Nations Population Fund, are working to increase the number and improve the skills of birth attendants throughout the developing world. This UN project in rural Guatemala is typical. It aims to strengthen midwives' practices and better equip them, as well as raise awareness of danger signs in pregnant women within indigenous and often inaccessible communities. So wherever a woman may be, it appears that a safe and successful birth are dependent on the same things: the availability of midwife support and timely emergency obstetric care where complications arise. It's been estimated that increased midwife support, especially in the developing world, could save more than 500,000 maternal deaths each year and prevent over 8 million illnesses that arise during pregnancy and childbirth. But developed countries also need to take action. Here in Britain, midwifery and other services are clearly becoming victims of health service cuts and closures, and that's already affecting maternal health. I'm Reuters correspondent Michelle Carlile-Alkhouri in London for Times Now.